Hello, good evening, good afternoon, good morning. I can see people joining us. You're welcome. Please feel free to leave your name, organization, and country in the chat. I can see lots of people. I see Cedric. Hi, Cedric. Sandra, Charles Innocent, welcome. I see Felicita. Good to have you here. Ezra, Elizabeth, you're welcome. Farai, you're welcome. Welcome, everybody. Just drop us your name, country, and organization in the chat so that we have that for our records. I see Judith, I see Katarzyna, you're welcome. I see Robert, I see Sylvia. Welcome, everyone. I see names that I do not want to massacre as well. Laurel, you're welcome. I see Josephine, Janet, Jane, Idrissa. Welcome, everybody. I'm just going to give it like 1 more minute before we start. Again, for those who are joining us, leave your name, country, and organization in the chat. And kids just decided to play in my background and make a noise. So I'm going to step out for 1 minute and 1 second and come back. This is the joy of working from home, you know, because you have no control about what happens externally. Yeah, but it's not so loud. I see Tom, you're welcome, Teresa. Okay, Patricia. So I feel like we are 42 in number, including our panelists, and I think that's a good number to start with. Hi, my name is Daughtie Ogutu. I am based in Nairobi, Kenya. I work for the Global Network of People Living with HIV GNP+ as Program Manager on Stigma, Discrimination, and Criminalization Programs. I want to welcome you all for joining us for this very important webinar. You know, I must say, as a person living with HIV, what a huge privilege it is for me to moderate this webinar. And this is because like 20, 30 years ago, we were all told, you know what, we can handle the AIDS pandemic. But here we are. And all this is because of the global solidarity that we've had in the HIV response, and we've made so many milestones. If I look at the progress we've made from science to political commitment to community advocacy and community leadership and political leadership, we have, I do not have the stats with me, but we have people living with HIV who have access to ART treatment. And people living with HIV are now celebrating being virally suppressed and undetectable, including myself. So wherever you are, I just want us to take a minute and pause and just applaud that is such a great milestone for each and every one of us. Thank you. So from biomedical prevention efforts, we have reduced incidences of HIV. Since 2010, the number of people acquiring HIV has been reduced by 38%. And also in 2020, the data that we have is that HIV-related deaths have also reduced by 51%. That is also something worth celebrating. So it is such a great honor and a pleasure that we are all here today and having a conversation around HIV sustainability. So I just want to thank you all for joining GNP Plus, UNAIDS, and all our different partners who've put this together and are together walking with us with this journey around the HIV response sustainability. In January of this year, UNAIDS released the HIV response sustainability planning process. I believe some of you may have already engaged in the process. If you haven't, then you're in the right place. You will get to know what's happening. And today we're just going to dive into the planning process of what the HIV response sustainability looks like. So the main objective of this webinar is to bring communities of people living with and affected by HIV together to share an overview of what that planning process looks like and to help us understand how we can meaningfully engage and participate and ensure that our communities are, our community priorities, our communities are engaged in the process and that they are meaningfully engaged. So throughout this webinar, please feel free to just share some of your experiences and your thoughts as the session is going on. This is the first of its kind. And what we are going to do, what we are committing to do is that we'll have some other sessions planned where we can engage in this conversation. But for those of you who will be attending the AIDS 2024 conference in July in Munich, we will have the chance to have this conversation face to face. So that's also an opportunity, and we'll see how far that conversation gets us. So mark your calendars and you'll get invites for that conversation for those who will be there in person. And we can also just look at having it as a hybrid conversation so that people can still attend virtually for those who will not be at the conference. Okay, so let's get started with this conversation. And like I said before, when I started, put your questions and comments in the chat. If you're coming in right now, please remember to say your name, your country, and which organization you are working with. And we will be able to filter those for our records. I have a very wonderful panel with me. And enough of my voice, I would like my panelists to introduce themselves. So in no particular order, I'm going to start with Jaime Atienza from UNAIDS. Please introduce yourself.
Good morning, good afternoon, colleagues. What a beautiful introduction you've done, Daughtie. So congratulations for that. It's my pleasure to be here with you all. I work in UNAIDS leading the equitable financing practice department that looks at the financial aspects of the response. And I'm also working together with my colleagues in all the different departments, the sustainability roadmaps initiative inside UNAIDS. So that's what I bring today, and it's a real pleasure to be with you.
Thank you, Jaime. I will move on to Florence.
Good morning, everyone, and thank you, or good afternoon or good evening, depending on where you are. Thank you so much for joining this call today and excited it's happening. My name is Florence Riako Anam. I am one of the 2 co-executive directors at the Global Network of People Living with HIV. And again, still excited that we are all here talking about the future. Thank you.
Thank you, Florence. And lastly, I'm going to go to May.
Hello, everyone. Good morning, good afternoon. My name is Meirinda, Sebayang, but people usually call me May. I'm the chairperson of the National Network of People Living with HIV in Indonesia. And just recently, I'm being elected as the vice chair of the Sustainability Technical Working Group of Indonesia. Thank you.
So a round of applause for our panelists. You can see we have a panel of people who are really, really engaged with this conversation and the content. So you're in the right place. I want to start with Jaime, and from your perspective, UNAIDS launched this early this year, the HIV response sustainability primer. So we are in the beginning of the planning process. Could you summarize, in your own words? I know it's a very long conversation, but summarize for us what the HIV response sustainability planning looks like, and most importantly, how communities of people living with HIV, affected by HIV, can meaningfully engage.
Okay, Daughtie, I have a full presentation to share that it's hopefully going to help explain, but I think I'm going to try and start by answering your questions right away. So I'm trying to do it in a very simplified manner, because probably it will ease the flow of the webinar. I think the first thing to say is that this approach to sustainability and to sustainability roadmaps comes with some new aspects. I think the first new aspect is that we are seeing that, of course, as we already knew, the end of AIDS as a public health threat by 2030 has a certain meaning, but it doesn't mean that it's the end of AIDS. So sustaining the response is not just sustaining the response as it currently stands, but rather sustaining the impact to get to that point, to 2030, but also getting ready, ensuring we get the right policies, the right financing schemes, the right services, the right level of integration, the right level of many different dimensions, so that we are better served for a long-lasting response beyond 2030. So sustainability, or a sustainable HIV response, refers to this. For that to happen, we are aware that the response will need to change from where it is today and gain new attributes, be aware of the evolution to move into a new status. And to answer once again the last bit of your question, what is the role and how do communities engage? How do we want communities, or do we want to promote communities to engage? Our intent has been to be listening, integrating views from community organizations since the thinking started, since the process was being developed, being open to receiving comments on this more boring conceptualization, but very especially having the voice of communities from the global level, being part of an advisory committee that is being set up and that will have its first meeting in the coming month, where we have 5 members of community organizations, civil society, youth present. So it's the larger group in that committee, that is an 18 people committee, but very especially at the national level, in the guidance we are sharing and in the instruction and the spirit we are sharing with our country directors that are initiating, playing a facilitating role with all the actors. The role of communities and the presence and participation of communities is an essential part of it. So when working groups are set, when different consultative structures are created, that's a space, or that's the space for community organizations at different levels. So I just wanted to say this right away in my first 2 minutes, so that we have that substantial message delivered. And then probably for the ease of the conversation, I'm going to share part of some of my slides. I think probably it's too much. We always tend to do too much, but let me just start by saying that one of the approaches by UNAIDS is that we know what the path to end AIDS is, so we know what needs to happen, how it needs to happen, but it doesn't mean that it's going to happen that way without the work, without the strong advocacy by community organizations, without the participation of community organizations, but also without the leadership of governments, without the contribution and participation of other international actors. And at the same time, we see that the response is in danger, as we were saying in our report in 2022, when we were identifying a series of challenges, political challenges, human rights challenges, financial challenges, and even challenges to the changing priorities of the international communities of governments, where HIV was not at the level that it has been in the past. So we know that there are dangers, but we know there is a path. I think that's our starting point. We want to acknowledge all these circumstances, that going beyond 2030 is going to require transformations, but that we will still need HIV-related interventions. And it's, of course, critically important to make sure and to ensure that after 2030, not only many aspects continue to be attended and many policies continue to be advocated for, and good services are in place, but especially that people living with HIV can enjoy safe, long, and healthy lives. So maybe some attributes of this is that, yes, we are looking in the long term. No, this is not about a donor exit, but at the same time, when we look at the numbers, we see that the resources by donors is not in a growing, but in a declining trend. So we need to keep that in our mind. And the response is also, the roadmap we are proposing is not about sustaining the response as it is today. So about how do we sustain financially the response as it stands? How do we find the money for this? But rather, how does the response needs to change to adapt to a changing landscape? And let me not stop too long in this, because I think it's good that we can take a look. This is a visual projection of the financing of the yellow bar is the financing needs for the whole response. The other bars, the red, is the domestic financing that, as you've seen, has been declining, not very much, but steadily in recent years, but also the international financing that we are seeing also, that is declining at a rate of 2-3% in the recent years, but we know that this is something to bear in mind. So we have a financing gap. We need to fill that gap, but what we are seeing is that we are going to need to stimulate domestic financing and international solidarity. This is a stolen slide from my dear colleague, Mary. Yes.
We cannot see your slides.
Oh my goodness.
Yes, I'm seeing that pop up in the chat, that we cannot see your slides. Could you stop sharing?
Let me try again.
Once again?
Let me try again. Yeah.
There you
Can you
go.
see them now?
Yes.
So,
Great. Thank you. So
let me see. Is this full screen or not?
Just click on that.
Really?
Click the slideshow. You move.
Is that okay now? Can you see these bars?
much better, much better. Thank you.
Okay. So that's, I was talking about the financing. I made the point. This I was saying is a stolen slide from my colleague Mary, and from the work that some of you, I mean particularly you, Florence, was involved in. This is coming from WHO, and that's to give us like a visual of where the AIDS response stands today. So it's not yet even a disease control, not to mention elimination and eradication. So we are in that particular red point as a descriptive way of making it visual. These are some of the when we talk about how the response needs to change and adapt, this also comes from the work that the group that is modeling the future of the epidemic is developing. So we see how the population pyramid changes how the projected number of people living with HIV changes or evolves depending on different scenarios, and how the incidence rates, that's a South African graph, but we could have it for many other countries, is also changing. So to a changing response, we will have to see how, as we move into the future and beyond 2030, also the response, the HIV response as a whole, needs to adapt. Here, we have to raise again the alarm. While we see a decline in annual infections, this is not equal across regions, and it's not sufficient. We are not hitting the targets, and that's something to be very concerned about. So that's the overall picture. That's where the disease is as a whole, where the evolution is, where the financing is. And here we come to the new proposed definition that comes with this sustainability approach. The definition that we have included in the primer that you may have read has a lot of concepts, and of course community-led organizations are very important. So that's the definition: countries' ability to have and use in an enabling environment, people-centered systems for health and equity, empowered and capable institutions and community-led organizations, and adequate, equitably distributed resources to reach and sustain the end of AIDS as a public health threat by 2030 and beyond, upholding the right to health for all. So it's a combination of different elements, and we also came up with this shorter backdrop definition, that is where we look at the country's pathway for achieving and maintaining the goals, and also for ensuring the quality of life of people living with HIV beyond 2030 through political, financial, and programmatic drivers. That's like a simplified version that can all of us help all of us understand. And I have to say that this work that UNAIDS is leading on has counted on the contributions by community organizations, and also in a close collaboration with, especially with PEPFAR, that has been involved in part of the conversations in all the initial stages. And some of you will be familiar with the fact that there was an initial meeting in Washington in last September. Some of the overall rationale, and I've highlighted in yellow because this is a general presentation where we are seeing, where we highlight not only the role of communities, but the challenges that relate to what communities are most involved in, and how those are incorporated in these broader approaches. So we want to see a sustainability that upgrades and strengthens country leadership and ownership. This doesn't mean government leadership and ownership only. It means country leadership. That includes communities. It also front loads discussions and agreements on the transformations that are needed for impact at long term. Of course, treating HIV and the response itself has a lot of elements, a lot of attributes, and changing or moving one single attribute or one single service or even one single clinic and how the work is being done, or changing a policy, a bigger challenge is difficult. So talking about what needs to transform is very important. We also want to ensure the highest return on investment on the resources that are today available, so that we get as best as possible prepared for the post-2030 world. So we are looking at 2030 and we're looking at beyond. But probably as we look at the initial years, we need to make sure that the money, the resources, the existing resources are used very efficiently so that we are better prepared for the future. And it also includes integration elements and health system strengthening. And the idea is that it influences every partner plan, future plans. So it helps not only drive country leadership and strengthen government plans, communities plans, but also it allows to influence the future plans of large donors such as PEPFAR, such as the Global Fund. Well, I don't want to extend too much. I also mentioned some of these other dimensions that are important, but it's critical to set out some of the challenges. limited prevention investments, especially for key and vulnerable populations, challenges to human rights and human rights backlashes in some contexts, the relevance of community-led services, but also the need to strengthen those as we are moving into a new future or a future state that has yet to be set. And the health systems integration and universal healthcare that is really high in the priorities of I would say most of the governments, and that's a pathway that we are seeing as we move. I will not extend on the financing because that's my field and it will get boring. Let me just move again to some of the synthesis of how the roadmap should be happening. Well, it should be, we are proposing to be country-driven, country-tailored, and flexible. So really flexible, not like rigid stages, everything needs to be done and needs to follow a pattern, but rather adaptative with a multi-sectoral approach, not only health, but health and beyond, and many other, the health systems and the systems for health, as we used to say, and with communities, people living with HIV and key and vulnerable populations at the center. It will intend to outline a concrete, quantifiable, evidence and science-driven plan for political, programmatic systems and financing transformation. Again, it's not a donor exit strategy, but an opportunity to engage, anticipate shifts that will be required to sustain impact, and better advocate for government and future donor funding. So let me stop in this solid sustainability roadmap, strong plans on how the future needs to look, what the future needs to look like. We're also making a compelling investment case or call for contributions by different actors. So let me advance a little bit more, just to say there are different stages. We are thinking that we need to start with country dialogues that will have different shapes in different countries, then with a sustainability assessment, and we are intending to launch in the next 2 weeks our tools on how to drive this assessment. That will be flexible, but the idea is that it happens at a country level with the multiple stakeholders, with community participation, of course, and that it not only assesses at a broad but not at a deep degree the status of the HIV response, but also the multiple challenges, the gaps. So once we have the assessment, we will be able to, at a country level, identify high-level outcomes, key priorities, and that's when we move into working on the roadmap part A. We are calling roadmap part A, and I can get into more details, but I don't think it's good at this point, to a synthesis document. We are thinking of a short document, 15 to 20 pages, where the main results of the assessments are contained, the high-level outcomes, what it's decided and discussed and agreed at country level that should be leading topics to drive the response to a better future are contained, and main transformations are brought. And the idea is that by the end of the year, we can have this synthesis roadmap, a short synthesis roadmap. Of course, the calendar is tentative. This is what we are aspiring for, but we understand that there are different national situations. And let me look at some of the key challenges, but I think, well, most of these I think we have been mentioning, and I think it's important to keep them in mind, but I'm going to move to the end of my presentation so that we can look at community and civil society participation. Of course, there's a consultation in the design phase and the ongoing tool development that needs to be incorporated. And you know well that from UNAIDS, we are bringing that vision in, but it's not from UNAIDS, it needs to happen. Coming from the community organizations themselves, and that's why consultation processes were open and comments were collected. We want always the presence of community organizations, particularly of people living with HIV, of GMP plus, in high-level moments and webinars where we share views and steer. In fact, I can share with you that we are struggling to manage to get the leaders of UNAIDS, PEPFAR, and Global Fund dates aligned into one high-level webinar. We had it locked for April 3rd, but then something happened. The Pandemics Fund board was called, and then had to dismantle that, but we are looking forward to that. And Florence was invited to be one of the speakers there, because we want to make sure that in every single moment it's seen that it's not an addition, it's part of how this needs to happen. As I was mentioning, there are 6 members of civil society, key populations, people living with HIV in the advisory committee that is starting to move very soon, and there is a clear indication to have communities, community organizations, and community-led organizations as key participants in country-level dialogues. That's starting to move in some countries. It's slower in others, but it's critical since the very beginning. UNAIDS country directors are playing a facilitating role in the start of the process at country level. So they are the ones that are reaching out and that should reach out. And when there is a doubt or there is a willingness to know more, to participate more closely, that's our entry point. We have a core team, and you have, of course, our communities, our fantastic communities team in UNAIDS, but that's a country level entry point, very clear. The participation from the technical working group at a country level, multi-stakeholder dialogues, engagement in the assessment. In the next 2-3 months, assessments will be started and carried forward, and also in the validation spaces around the elaboration of the roadmaps will be important, and is in the plans. And then community systems and social contracting are a key aspect to bring up in the future looking design. One of the things, and this maybe I'm looking more from my perspective on the equitable financing aspects. So we know that this is a big opportunity to institutionalize social contracting and the participation of communities in the systems, and this is an important opportunity. And of course, human rights and everything that is related to the different groups of key populations are to be highlighted during the process and to be brought up. I want to just stop finally by saying that this is what we have been thinking about and working on, probably in a rush, probably not sufficiently post and well structured, and more engagement can and should be happening. But that's where we are for now, and now we are keen to listen and open to suggestions. Also keen to think together about training and other opportunities to better prepare communities for the engagement. I think that's a relevant point. And I have to say that our colleagues from PEPFAR were having the same reflection themselves. So they may be thinking of something from their own end, and we want to think of something together with communities on what may be needed to facilitate, to strengthen the capacity of communities to engage. And working on that is something that we are keen to hear from you today and at any moment. And finally, of course, any other relevant feedback on the whole approach and what's missing, what's needed, what concerns you, that would be excellent. And let me stop here and apologize. I took longer and I lost track of my clock because I have the screen full of things. So my apologies for that, and back to you, Daughtie.
Jaime, are you there? Can you guys
Yes.
hear me?
Yes, we can hear you. Hi, Daughtie, can you hear us? Cedric, do you want to? Okay, there you are.
Sorry, did you guys lose me?
Yes, you were frozen for a minute there, but you're back.
I'm really sorry. So thank you, Jaime. That was a whole lot of information that I feel like it's very useful for, I'm just looking at the chat and seeing who is in the room and who needs this information. And I'm very sure some of you have picked bits and pieces about how you can engage. Key takeaway point that this is happening at country level. You want to engage country level. You need to get in touch with your UCDs because they are responsible for initiating the process. I like that, the whole response sustainability, the plan that you really thought about some of the challenges and what we are struggling with in the path towards ending AIDS. So that's very good. talking about human rights and the challenging priorities, especially around funding, shrinking civil society space. Those are good things that we've seen in that. But really, there was a lot in Jaime's presentation. We are definitely going to share that with you. And then we'll come back for questions, because I did see a couple of questions there around targets 2025. Why are we not reaching them? There was a question on refugees. But I want us to move on to Florence. And so I'm sure you've prepared a presentation that you're going to give us. But as you're presenting, this is what I need to ask from you is, the response sustainability planning is going to take place under the leadership of government. We all know how that goes. So what do we expect? What is there and what should stakeholders expect and what should they do? And the second part of that question is, how ready is GNP Plus, me included in that question, to provide leadership and support for our communities of people living with HIV to engage in this process? Over to you, Florence.
Hi, Daughtie, and everyone else. I don't have a presentation because I was told it was a conversation, but I will try to answer your two questions in a flow that sort of makes sense and explain a little bit. And I will start with your second question, is GNP Plus ready? Yes, we are. I think we have been ready from 2021 when Cedric, myself, and a few colleagues sat together to think through about what gets us to 2030 and beyond. And I think a lot of people on this call, our community peers at country and regional levels, were very supportive in the development of our new strategy. I don't think it's new when it's 1 year old, but we launched it last year in June. And if you look at the tagline of the GNP Plus strategy, it's written "Future with Communities." It was in purpose because all the work is centered and geared around how do we start now to move along our work? What's needed to ensure that people living with HIV do not get forgotten post the SGDs? And what is the plan post SGDs? And understanding that we do not want to be caught off guard in 2027, can we start now to influence the different parts to come together as communities to build and strengthen the HIV movement, to engage with these conversations because they are political in nature and they happen at country level up to global level. So that is the basic intention guided by our strategy and the work for which we are engaging with UNAIDS and colleagues at PEPFAR Global Fund and with our colleagues at country level for this. So I sort of answered question 2, and I think I want to just sort of highlight a little bit what we've done so far. In 2022, we brought together our colleagues from all the global networks for people living with HIV, ICW, the International Community of Women Living with HIV, and Y+ Global, and from our global key population networks, NSWP, Impact, Input, and GATE. And we came together under the Future of AIDS Movement Initiative, who are hosted by UNAIDS. And this initiative is engaging, and I think some of you have also probably engaged with the process. To date, we have, at the end of last year, organized population-specific conversations. It's just the conversations, trying to reimagine what the movement will look like in the current state we are in. HIV is losing its exceptionalism, funding is flatlining or going down. We are facing some of the worst human rights attacks and a regression of laws. We are facing varied levels of inequalities that continue to be barriers for accessing treatment, getting adherent, remaining on treatment, and achieving undetectable viral load that we need for the quality of our lives, but also accessing HIV prevention interventions. So all the environments that we exist in, what kind of intergenerational conversations do we need to have? What can we learn from the activism of the past? What can we take into the future? And all these things have been happening since 2022, very intentionally at community level, and now linking from last year with the UNAIDS interventions. I have been representing us in a few of the shaping discussions pretty much most of last year, and colleagues from the KP networks also as well joining, and a lot of the things that Jaime has presented has been with us together. So I think moving forward, what do we need? I've answered is GNP plus ready. Yes, we are interested, and it's not stopping now. Our measure of success is not an end game. There is no end game to this. It's highlights for different pieces. We are connecting with the various global interventions coming up, the review of the current strategy, the development of the next strategy, the next HLM, whatever discussions around the SGDs, the global fund replenishment. So for us, it's a continuous piece of work with highlights up to 2031. In terms of what do I think governments and partners should do, I think that's where I'll probably a little bit stress. I think we have to admit the critical process for which we are engaging here. We've made great progress in biomedical and scientific side of HIV, but many of us don't enjoy the benefits of this progress because of the social barriers we face and because of the inequalities that we have. And so also acknowledging that these are the functions that remain not well resourced within the HIV movement. And also acknowledging that the work to getting us increasing attention to the social barriers and the social enablers and the aspect around HIV criminalization, HIV stigma and discrimination generally, and for key populations, and specific populations that are never on the table, like children, are rarely funded but must be funded. To push for this is the political investment for communities' engagement in the process that is needed. So I hope that governments would own this process, because we need their political leadership and goodwill to be able to sustain what at country level has worked, adapt to what needs to be adapted, so that we can move into the future and have a more resilient national level HIV program. And for this to happen, we need everyone at the table. Often communities are not there, and when they are there, it's not enough to shift anything because we don't have the resources to be able to engage with the process fully and to get as many of communities engaged in the process. In a country where people from key populations, people are criminalized for their sexual orientation, gender identities, or for sex work, I don't think they are going to make it to a government-led process. What innovations can exist to bring their voices to this process? And those are some of the things that I think our donors present, if they are here, or if there are conversations with donors, with partners, they can help organize. Community has always found ways to bring us together, to mobilize silently sometimes if there's need, to get more of our voices organized. So yes, a few of us are sitting in the processes that are government-led, but how can we ensure the others who are not there are engaged? And I think this is where it is critical. So the country ownership and leadership is critical, especially for the political commitment, but also because we will use the country data. And when you start to use that data, it's hard to run away from the things that we don't want to run away from. So can we use data, and where there isn't, can we find data for the population specific that are specifically getting left behind? So data informs this process and ensure that all stakeholders are involved. I know we are talking a lot about centering communities, and I just want to close by defining what that means for me particularly, and I hope that it resonates with a number of our colleagues that are in here. I think we need to understand that centering communities will include both the leadership of their engagement in this process, how they will lead it, what points they will lead, but also what point will they follow and sit with you and engage and collaborate. And those are two separate things. So doing one and expecting that to cover both isn't going to get us there. There are parts where we have to step aside and lead ourselves into getting as many of us aligned, going together within the process. And there are parts where we join a process that's going on, led by UCDs, led by UNAIDS, led by PEPFAR, etc. I think intentional centering of communities will involve supporting communities to convene themselves on their own in their own safe spaces. And these convenings can be age specific. We have done our own consultations as people living with HIV, and we clearly see how there's a struggle sometimes to bring out the gendered aspect. So the women living with HIV, or the women and girls most affected by HIV, have to step aside and have their own conversations. Young people have to step aside and have their own conversations. Key populations have to step aside. So these conversations have to happen differently. I think I just want to ask that, I know there is no money, and I hear that a lot, but how can we use what we have now? What flexibilities can exist with the funding that we have now to ensure these interventions and these conversations happen? Our work brings together communities. Can we carve out space and time for these conversations? I think it is critical to look around and see who else is missing at different levels and take leadership in ensuring that they are brought forward. And finally, I hope that we have consistent and continuous updates at all levels, because 2031 is 6 years away, and we have a lot to do between now and then. We have to keep getting and staying connected with this. And with just those very many remarks, I will stop here and take questions. Thanks. Back to you, Daughtie.
Thank you, Florence. You know, when Florence speaks, she speaks so passionately about communities that you can just get lost and get carried away when she's speaking. But I think like her message is like very clear, and it comes from a very personal point as well, right, Florence? That you know, when you're thinking about communities, like we have different cadres of communities, and being very intentional and being very deliberate in how we support those processes to happen. And it's not really about just ticking the box, but being very deliberate and understanding that we come in different shapes, sizes, and forms, you know, as communities. I'm still encouraging you all to put your questions there. I'm gonna come back to all the questions. We'll have a Q&A session, but I want to move on to our last but not least final panelist, Meirinda. And May, you have had first-hand experience because Indonesia initiated the planning process and communities were invited. So maybe you could tell us what your impressions were of that process, you know, how prepared you are and what people really need to do to get prepared as they're going into that process of, you know, thinking about HIV response sustainability. And in your response, just maybe if you could see, what do you foresee as an urgent need for not just for Indonesia, so we're going to use you as our blueprint for Indonesian people living with HIV community. What do you see as an urgent need to ensure that they are engaged in the conversation, in the process around HIV response sustainability? May, over to you.
Thank you so much, Daughtie. Hello once again, everyone. So back to the questions, am I prepared enough? And what is my first impressions, and also the urgent needs to ensure that community engaged during the processes. So before I answer the questions, I need to give you a context of Indonesia, because we are a big country with more than 500 districts all over Indonesia, and we also have two types of HIV epidemic. So we have concentrated on also generalized epidemic of HIV. And our new infections and also AIDS-related deaths remain significant and require increased efforts. And now the currently cascades is at 79% for the first 95, for the second 95, 50%, and the third 95 is 43%. And then, although the government fully subsidizes our HIV treatment, but HIV preventions in the related community outreach components remain largely supported by external donors. But we are really glad that we have a good momentum right now with the government's health transformation agenda. And then our planning to sustainability will require very dynamic approach, and we have to ensure that the prevention program is also being identified as a priority, sustain viral load suppressions, and then don't forget about achieve the 10-10-10 targets by ending or reducing inequalities that drive of HIV epidemic. And then progress to date, we already have a few meetings with the UNAIDS Indonesia and also Ministry of Health. We have an introductory dialogue with Ministry of Health of Indonesia to propose a plan to develop Indonesia HIV sustainability roadmap. And our Ministry of Health of Indonesia confirmed its leadership in the process. And then we also we already had discussion to establish the sustainability working group, and we invite not only from the government side but also the representative of the community and also civil society organizations. And hopefully we will have our country sustainability dialogue in I think next 2-3 weeks. We're still waiting the confirmed date from the Ministry of Health, but not only from the Ministry of Health but other ministry and also development partners. And hopefully we can start our sustainability assessment exercise, and we really hope that we can implement our assessment at the 3 subnational sites, Jakarta, Makassar, and Papua. So back to the first question, yes, I'm prepared. I'm prepared, but this is not only me or our organization, right? Because the other the people living with HIV and other community also need to be prepared and ready, because this is not easy. Currently, we are implementing our program because we still lag behind from our case kit, but in parallel, we also have to start our sustainability HIV response planning. So my impressions of HIV response sustainability planning very various depending on factors, because the healthcare issues, the healthcare access is still become an issue in Indonesia, and also the stigma and discrimination. Because from our stigma index 2.0, we know that the self-stigma, external stigma is still there, still need to be reduced, and also stigma in healthcare facilities and healthcare setting is still huge. So I agree what Flo already addressed about how to ensure that we can convene together, but not only at the national level, but also at sub-district level. And then we realized that the needs of people with HIV is vary from person to person. We talk about children, we talk about women, we talk about young people living with HIV, we talk about elderly, we talk about key populations, don't forget about migrants, disability living with HIV. So I think currently the big homework for us is to ensure that they are sitting in the forum, they are they voice being heard, and the big question is how to support them to engage. How to support them to engage, how to ensure that they understand what is happening. Although now we already have an assessment on transitioning from donor-funded health programs in Indonesia from World Bank. We have a transition readiness assessment by UNAIDS of Indonesia has been conducted in 2022. We also already have investment case analysis. And also we have a sustainability index dashboard and responsibility metrics. So what we are going to do now, because at the national level, community representative, people living with HIV, representative in Jakarta national level, they maybe understand, they maybe can follow, and they maybe can be have a meaningful engagement during the processes. But how to ensure that the voice from the sub-district, from the village also being heard? So we need to organize ourselves. We need to hand in hand together, make a very big collaborations, parallel, although we are implementing the program, but also we need to have a very systematic or structural approach to ensure that the voice from the very small village also can be heard during these processes. And then from my side, we need to meaningfully participate in each working group. We now we have 5 working group of HIV response sustainability planning, and in each sub working group, we already identify sub teams that it's really hard to I think from some of the communities, it's really hard to understand what's going on the sub working group. So from my side, I think communities need to convene. Maybe we need to establish a community forum, not only at the national level. Maybe we can also establish at the provincial or district level. So I really hope that by establishing this forum, we can identify the priority needs, the gaps, and also data-driven solution from community perspective. I will stop there, Daughtie.
Thanks, May. No, I think it's very true, because as communities as well, at national level, we might have the information, but then what happens to our communities on the ground, at local level, in rural area, in remote areas that do not have the same information we have from those of us that participate in national level processes. So I completely agree with you that as communities also, we need to systematically organize ourselves and again, bringing back the issue that Florence had mentioned and was mentioned also by Jaime around funding and not having enough resources to be able maybe to come together and do these things, but ways in which we can work and collaborate with other partners and stakeholders who are able to reach where our communities aren't, and they can be able to support us in organizing our communities to have this conversation around sustainability. So thank you so much to our panelists. I think they have just shed light into so many things and so much food for thought and planning and thinking that needs to happen. But then I want to come back to comments. I'm seeing quite a number. We have comments and chats that some are posed directly to, not directly to anyone. So please, panelists, feel free to respond. So this, I think, was for you, Jaime. Can you address the 2025 targets and lagging behind in reaching them? So that's question number 1. There's a major, number 2, there's a major concern with sustainability. Is domestic finance, is that the same as domestic finance?
I think Daughtie is frozen again, Jaime. As I'm listening from the background, the question is in the chat. I think it's Dennis who is asking, how is different a sustainability country dialogue from a sustainability country assessment conversation? I think maybe you already read the question. If you can maybe try to shed light on that for Dennis and everyone else. Yeah.
Absolutely. Thanks, Cedric. And while we get Daughtie unfrozen, there she is.
Daughtie is my internet is just not cooperating with me today. So I'm sorry. Okay, I'm not seeing the chats now.
I can, if you want, Daughtie, I can take on those initial questions and also react to some of the points that were made, and then we can move to others. So first, I wanted to say that we are truly committed to find ways to bring together community organizations for training and for exchange on this. So you'll tell us what are the plans that you are having. And it's true that we have resource constraints, but that doesn't mean that we cannot find resources for important initiatives to make sure that there is good participation, better understanding, etc. So we are open to hear from you and keen to think together and to find resources for that particular purpose. Just to I just wanted to mention that there are many, very, very sound comments that have come out of what Florence and May have shared in terms of the more global vision and the local communities and how they can engage and how not, and how it's important to bring along different organizations that so that they can be participating. I think that's a very important point. Also, the fact that in May was giving us the example of Indonesia, and there will be many different examples, but the fact that there are already different working groups looking at different aspects can give us the sign of how complex on the one side and how rich on the other side is going to be. So getting ready for it is also an important task, and again we are keen to find the ways of doing that in the near future. Some colleagues were asking about the 2025 targets and those targets that are lagging behind. The fact that in this future-looking sustainability approach, the first step is, of course, getting the people together and getting to think together how are we going to approach this. But the second step that comes in the coming months is precisely doing an assessment. And the assessment has, like, I would say, two sides. A first side is looking through a wide set of domains where we can look at different things, from the services, from the prevention, from the situation of key populations, to the human rights or the rights related policies and laws that are in place or are not, to the degree of political leadership, to the level of economic commitment. So all these different things will come in that initial assessment. So and the second part of that assessment is making sense of what the assessment says. So after looking all through this long list of domains, what are the main gaps? What are the main challenges? What are the main opportunities to accelerate, to improve? It's true that the 2025 targets are so close to us that this process is looking beyond the 2025 targets. I think a related point here is that during this year, the UNAIDS, together with many of you, with many partners, will be working on the establishment of the future targets. And there is a process that will be ongoing and that will come with some results at the beginning of next year. What we are thinking on how to combine that new target setting with the assessment and the future-looking sustainability roadmaps that we are elevating here is to focus the work of the sustainability roadmaps in identifying gaps and opportunities, specifically at country level. You know, the targets are set at an overall level. So doing this at a country level and making sure that when the time comes of the planning phase, so after doing this sustainability roadmap, we are calling it part A, where we are getting these high-level outcomes and transformations identified, a planning phase will start in 2025. And there, the new targets that will have been identified will be factored in. That's how we are thinking about that. And finally, another question was about the domestic financing role and how domestic financing is essential. I think obviously domestic financing is an essential part of any future sustainability action related to AIDS, but also to agriculture, to education, and to any other dimension of our lives and of development. This doesn't mean that the sustainability roadmap is all about growing domestic and reducing international. What we are thinking is that we need to grow domestic and create new incentives for increased domestic contributions, and some of those incentives will come out of the fact that the investments in the HIV response are essential to build a more solid primary healthcare system, and will help drive services and ensure better services for wider groups of populations. So all that integration dimension and the other we can call them dividends you can obtain out of the fight against HIV. Getting a community system in place that is effective allows to respond to other pandemics. These other dimensions are going to be critical for that. So it's domestic financing, yes. We need to increase, yes. Will it be HIV standalone? I think we will be able to identify, but it will be combining gains for HIV and for other purposes. And we could have a long chat about this and a country by country chat, because this is different in different countries, and probably thinking of Kenya and thinking of Indonesia that I have in my screen now. We could talk very much in depth about this and these approaches, but this is definitely coming through. And I'm going to stop here because I don't want to cope all the conversation. So back to you, Daughtie, and apologize if it's too long.
No, not at all. Not at all. That's quite informative. Just also looking at comments here, there's a comment: human rights tailored approaches are inevitably essential in the fight of HIV. However, these approaches are deemed political by governments. So again, from a community perspective, May, Flo, how do we address this when we get to, to those conversations? We need to talk more about people aging with HIV. So, and I know GMP Plus is doing a research on advanced HIV disease. That's another, maybe you can touch on that a little bit. There was a question around talking about inclusion of communities. We also need to highlight the need to understand and address knowledge and capacity gaps. So knowledge as a key resource for engagement. So maybe if you can touch on that around how this community conversations and consultations play a role in addressing issues around knowledge and capacity gaps. Flo, May, anyone who wants to go?
I can go fast, and I just pick up a little bit on, I think there are so many, as this is not the actual consultation, I think this was just basically to let us know that there's this process, and just to highlight that there will be different points of conversations, and thank you, Jaime, for the offer to get us all together, and I think we will follow up on that. But at different country levels, and as May was also speaking, I've taken notes, we'll follow through. And I think there's different bits and pieces that GNP Plus can do, get people who are probably connecting with the different country processes, so that there's some way of cross-sharing and cross-learning across the different thematics and topics, and connecting around the difficult or the good things that are happening with the process, so that there's also touch points of lessons and cross-learning and sharing. And those are things that we can think through. But specific to these conversations, I think just to pick on what Jaime said now, what got us to where we are at. I think I always fondly refer to the period between 2011 to 2015, because I feel it was like the boldest period of the HIV response. We set out to put 15 million people on treatment, and it was actually achieved before the target date or period, I think. But it shifted to a large degree, and it brought everyone together that period, because the researchers, the people who work on the medicines, the people who work to make the medicines available, the donors, the community engagement in the process, and the leadership of UNAIDS getting every multi-stakeholder engaged. I think that period shifted significantly the HIV response. And there's a lot to learn from there. And primarily, how that happened is how I think we need to think about doing this part. What's missing where? What do we want to sustain? We have people on treatment, and we know when people are on treatment and they are undetectable, they cannot pass this virus to a sexual partner, which was one of the highest ways for which to pass HIV to someone else. So how can we get more people on treatment and ensure that they are adherent and they remain on viral? If we want to sustain that particular component particularly, what does that mean? What does that look like as we are looking at the various things that are coming up? Research is working to get us a lot of new interventions, better treatment, long-term treatments. There's a lot of work now around long-term, long-acting injectables, both for PrEP and also for HIV treatment. what are the community perspectives around these changes? And those are some of the consultations we need to honestly have. What's stopping us from staying at the other end? Those are then the conversations we need to have. And I think if we are thinking broadly around integrating HIV into primary healthcare, that is a topic that's coming up right now. What does that look at different countries? What does primary healthcare look like? If in Kenya, for example, in Nairobi, is very different from the village I'm seated in. So these realities is why these conversations need to happen in a very layered perspective, and national networks or national key population organizations are supported to drive these conversations at that level. So the part on aging with HIV is, yes, we are here, we are aging. I like to pride the HIV movement as having been the one which has shaped the global health systems. We were told we would die in 10 or 15 years, give or take, but we are here now. So maybe it is time that we shape the health system in terms of how it takes care of people aging, because most of the aging health services is privatized, particularly in my country. But how do we take this back to the public sector, which is what HIV continuously does? It strengthened systems and services for young people with young people-friendly services. How can we do the same for aging people? So I think I look at everything as as an opportunity, and that's how I look at. Yes, we are here. There's a huge component of prevalence that will serve this discussion. And for me, I look at it as an opportunity for strengthening the service delivery systems, and I'm happy to have conversations at different levels with you. I'll leave it at that point. Thanks.
May, do you want to come in and input?
Yeah, so just recently we had our Zero Discrimination Day. So we had a very good discussion with the Ministry of Law and Human Rights, Ministry of Law Enforcement, Workforce, Ministry of Health, and also the National Human Rights Institution. So we discussed about our result of the Stigma Index 2.0. So this is related with the human rights issues. So because at least from our organization perspective, because we have our program on the tracing for those who lost to follow up, because Indonesia have a high number of cases of lost to follow up. So more than 20% people living with HIV already know their status. They stop their treatment because of various reasons. But the basic line is that the self-stigma and also stigma from external, from the health facility is still high. So there is some homework for us that we need to reduce stigma and discriminations. So from the discussions, we understand now that the HIV issues among interministerial is not really adequate. It's not really informed to other ministries that are related on HIV program. So I think the ongoing dialogue, ongoing discussions need to be continue engage with. Not only at the national level, but also we have to engage with the other law enforcement at the provincial or district level, because if you talk about HIV, usually we only communicate with the Ministry of Health, but it's really rare, at least for Indonesians community, it's really rare to approach other ministerial, like Ministry of Law and Human Rights, Ministry of Social and Welfare, and etc. So I think the ongoing discussions and dialogue is need to be continued, not only related on this HIV response sustainability planning. And then I also agree about knowledge. If we need to engage other community representative, other people living with HIV representative to sit together to discuss about this sustainability planning, we need to ensure that we can provide we provide informations in communities' language, so they can understand what we are going to discuss. Because from the five domains and sub-themes. We talk about governance and leadership. We talk about the programs and policy. We talk about system. We talk about sustainable, equitable financing. We talk about the sustain enabling environment and reducing inequalities. Sometimes the language is really UN language. It's really high language. So we need to how to say it, we need to ensure that during the discussions we can we can explain we can elaborate all the issues that we need to identify, we need to share, we need to ensure that the community representative can understand, to improve their knowledge, help literacy, because if we in the sub-working group, we will sit together with other key stakeholders. We will sit together with our government representative. We will sit together with our other donors. So to ensure that the community also understand their language, I think we need I don't know if we can identify such as training to share about the sustainability planning as in the community language. I think this is a next action that we need to ensure that we can implement Florence and other panelists, because I don't want, at least for myself, I don't want that communities only sit there as a member of the sub-working group, but as a tokenistic only. They need to sit there, they need to understand what they are talking about. Because in the sub-themes of these assessment domains, I think it's quite complicated, and sometimes if the communities sit in the forum or in the national meetings, they only share about their stories. But we need to improve their health literacy and knowledge, especially about the HIV response, sustainability, and planning. Back to you, Daughtie.
I could not have put it any better. So my apologies, because we've gone way over time. We are going like into 20 minutes over for this webinar. And I just wanted to come back and wrap it all up, just to say that this is the beginning of this conversation. This webinar is meant to highlight the fact that there's a process that has now started, and it's gonna like the entire primer for the HIV response sustainability has like 5 phases. So like phase 1 is planning the journey, which is what we've heard now. And then there's the assessment at country, the country level, country status of your HIV response. And then there's the roadmap part A, which includes prioritization and, formulating your objectives and what you need to get there. And then roadmap part B, I don't know why there's a part A and a part B. Roadmap part B, which includes the strategies and the indicators and monitoring and evaluation plans, like all that stuff that we do as implementers. And then the last phase is really the implementation and then monitoring of the HIV response sustainability primer. Like I said again before, is that we will have subsequent conversations hosted either by UNAIDS or PEPFAR or GMP Plus moving forward. But thank you for joining us. I want to check, do my panelists have one takeaway message? Just one sentence from each one of you. Florence, you go first.
I think one takeaway message here is we are together. The journey starts with all of us, and it's the bus is on. Let's get together and let's get going. Thanks.
May, if I come to you.
Okay, I think it is necessary to engage people with HIV and also the key populations and other communities that related to HIV in all decision-making processes and ensure that their specific needs are addressed. Back to you, Daughtie.
Wonderful. And then Jaime, if you wrap it up for us.
I would just say that please count on the commitment of UNAIDS to work together with communities and community organizations to ensure a knowledgeable and engaged participation and contribution, and bear in mind that flexibility for the whole process at country level is a must in this process, and we need to be the first ones to claim it, and we expect from you that you can join us in that, so that we can touch on the key points that are going to be different in different countries, but we are together in this one, as Florence said.
Thank you very much. Thank you very much to our panelists. And then the other set of people who we usually forget, our translators, who were translating for us for more than an hour. So thank you very much. Thank you to the GNP Plus team behind the scenes, Cedric and Lasejo. Thank you for putting all this together. We will share Jaime's presentation we do have contact details. So we will share the presentations with you, and it will come, and you will get updates also for when the next webinar and next conversations are happening about the HIV response sustainability process. I have been your host, Daughtie Ogutu. Thank you very much. Thank you so much for bearing with us, and we look forward to having this conversation again. Bye.